Hello, everybody, and welcome into Senior Living Live. My name is Melissa. Thank you so much for being with us. Well, recently we had a wonderful webinar led by Suzanne Price. You see her there, all about women's health and aging. Today, it's the men's turn. September is Prostate Cancer Awareness Month. We will start there and expand a little later in the webinar on men's overall wellness, cognitive health, and overall better aging. And of course, we want all of you to be a part of the conversation. To do that, all you have to do is scroll down to the bottom of your screen where you see the Q&A button. Feel free to type your questions out there at any time during the webinar, and we will be happy to have our panel answer those questions for you today. Well, Suzanne is back as our guest host, and she is joined alongside Dr. Randy Cronic. Hi, guys. Good to see you. Feel free to introduce yourselves to our audience here today.
Good morning.
Go ahead, Dr. Cronic.
Okay, I'm Dr. Randy Cronic. I have been in private practice here in Duluth, Georgia since 1994. I'm currently the director of senior care for Ascend Medical Group, which is focused mainly on whole health for senior citizens in assisted living facilities and office care. And as well, I'm the medical director for Capstone Hospice, and I have a private practice still in Duluth, Georgia, dealing mostly with internal medicine and geriatric care.
And I am Suzanne Price. I'm a registered nurse. I have been with Arbor since 2016. Prior to working with Arbor, I worked in coronary care in the hospital, in the emergency room, cardiac rehab. You name it, I've done it. It's been a lot of years and I love it. Senior living is my passion, and I am very happy to be here and have this time with Dr. Cronic to really talk about men's health and specifically prostate care.
Okay, well, let's start there. Prostate care. Let's talk about the prostate. Why is this a topic? Why are we even discussing this? What is the importance of having this month as prostate awareness?
Well, the most important thing is that prostate cancer is certainly on the rise. It's the second most common cancer in men, really in the world, certainly in the United States, and that's secondary to most basic non-melanoma skin cancers, which are very common. But prostate cancer is diagnosed at least 300,000 times a year. So 300,000 men are diagnosed a year with prostate cancer. It's also the second leading cause of death by cancer in men, behind lung cancer. So the difference is, with proper screening and preventative care, prostate cancer can be diagnosed in very early stages. And when it is, the success of treatment is close to 100%, at least 98% survival after 5 years. And the screening tests are fairly easy, simple things to do. I guess going back to the start, so we're all on the same page, the prostate itself is a small, basically walnut-sized gland in the men's reproductive tract, kind of under the bladder in front of the rectum. Its purpose in the body is basically to make fluid and nourishment, in semen for sexual function. Most problems with the prostate start coming around age 45, 50. Most of the time, and most of us men will start having some symptoms related to usually a benign enlargement of the prostate, which generally will come as more frequent urination, sometimes getting up at night more to urinate, trouble starting the urination stream, sometimes a slow stream. So most of those symptoms are not related to cancer. And that's what sometimes we get a little bit misled. We think, well, I don't have symptoms of cancer, so I'm okay. But that's not true. Prostate cancer, until it's usually advanced, will not have any symptoms. And unfortunately, the biggest symptom usually is back pain, and that's because it's already spread to the spine. So we want to educate men that this needs to be screened on a regular basis and not wait for symptoms. And unlike other cancers, symptoms come unfortunately very late, in the disease. So we want, we want people to be aware of that. And I think, that will help out tremendously on, our treatment success.
Suzanne, I'll let you follow up with what we should be doing or what our seniors should be doing in terms of maybe these screenings, or how companies like the Arbor Company can sort of push that so that in case it's kind of forgotten or not top of mind, that people can get these proper screenings and be tested correctly.
Yeah, so as Dr. Cronic said, you don't want to wait until you have significant symptoms. Prostate cancer is a very treatable cancer, and it is really just a shame to have someone in the later stages when it could have been prevented had they gone in for their regular screenings. So as many things in health and taking care of ourselves is we need to make sure that we are going in for our regular checkups. There are different screening tests that can be done. The diagnosis is made with a urine flow test, ultrasounds, and the PSA blood test, which you go into your doctor's office to get in. And Dr. Cronic, how often would you recommend having men go in for their PSA?
Well, what the general consensus now is, starting at age 50 in men that are considered normal or average risk, men that are high risk, which kind of fall into three categories: Black males, males that have family history of prostate cancer, um, and usually then men that already have, say, some symptoms. We would start around age 45. And we normally recommend that men come in once a year. And generally, the screening's done with a PSA, which is a simple blood test. We usually do it if you're here for a physical, when we check your cholesterol, your blood sugar. It's just part of the panel. And in my 31 years of practice, I diagnose several men a month still. No symptoms, come for the physical, and the PSA is high or it's higher. We really go by trends, and that's why it's important to do it every year, because the PSA still may be almost normal, but say it's gone up by 2 or 3 times since the year before. That's very important as well. There's some men that have cancer that still have normal PSAs, but they've normally gone up a lot over 1 year to the next. So we're able to, identify that, much early. And so, yeah, generally you want to do it once a year. Most experts recommend doing it to age 70, but personally, I base it on the person's health, their general health. Some men now are 90, they're very healthy. I would still do screening. They can be cured easily if we find something early, whereas there might, be a problem if not. So normally once a year at either 45 or 50 years old.
And let's point out again, you said something so important, those yearly physicals, because we are all different. And what is a normal baseline for me would not be for somebody else. And so we can't do a hit or miss or wait for symptoms. We have got to take care of our health and start early so that we have that healthy baseline for doctors to go on and compare as we age. Can I ask you, let's talk about the difference between benign prostate hypertrophy and prostate cancer, because I think sometimes people get it mixed up or think that one causes the other.
Yeah, there's really no obvious relationship between the two. Like I say, the benign enlargement of the prostate is close to universal for most men. Symptoms may vary from very mild symptoms to very severe symptoms. Most men will see, and I'm 61, so obviously I used to not get up at night. I do now. So I'm usually the one having to stop to the rest areas when we travel and not my wife. So that's a normal, usually thing we start seeing in people. Now, when we get more severe symptoms where it's very difficult to start the strain's very weak, sometimes even to the point of urinary retention, which means that it's very difficult to start urination. Now, those symptoms are certainly to the point where there are treatment options for just the benign, enlargement of the prostate, which certainly, even though it's a benign condition, can still cause some pretty significant problems for some men. Mm-hmm. So those are things certainly we need to get urologists involved and, take it from there. Again, prostate cancer, on the other hand, is, very treatable early on, but can be deadly if not treated. Fortunately, as a hospice medical director, I see men every month that are at that state, unfortunately. Mm-hmm. So when we see that most men, we see the PSA going up, we refer them to urologists. Nowadays, sometimes they'll do an MRI of the prostate, see if there's an obvious tumor they can see. If so, or if the PSA is very high, they know exactly where to do a biopsy, to see, well, is this a malignant cell or not? And the biggest advances now is not only you can tell if there's cancer there, you can tell how aggressive the cancer is. Some prostate cancers are extremely non-aggressive and may not ever even affect the person. So they may not ever be treated. They may just need to be followed over the years. Versus somebody that has a very aggressive tumor, which is determined by the genetic makeup once there's a biopsy done. Those people are certainly amenable to treatment and need treatment, or that's going to be somebody that would probably have significant problems, in a short period of time. So that's kind of how how it goes once you do the test, if there is an abnormality. And then you can get in later to, based on what you have, what are the treatment options? There's multiple. Usually the doctors will, discuss those options with the patient based on what they find, and then give you, these are your options. This is something you can research. It's not the same for everybody. Some people, now that hopefully take more, care of their health, will decide for themselves, or sometimes we need another opinion, and see, because there's lots of different treatments now for these problems.
And what are the different treatments for BPH?
Well, if it's mild, we always try the safest and easiest things first. So sometimes we'll just have men, not drink so much after 6 p.m. Maybe try some supplements like saw palmetto, or, there's lots of over-the-counter kind of prostate supplements. And a lot of times those work very well. Second step, there are some prescription drugs. There's a couple that we use. There's one that helps kind of the flow of urine. There's another one that really helps shrink the actual size of the prostate. It's very slow, but over time that can help. So that's usually the next step. Third steps, usually you're getting then into some kind of procedure. Now the most common ones done, if there's surgery recommended, it's usually done with robotic prostate surgery. That preserves the nerve function, the vascular function. So the side effects from the older surgeries usually are not there now, which generally were incontinence, and just trouble urinating, and erectile problems. So we've kind of gone away from that with the new surgical procedure. The other two things that are done now, there's a high flow water treatment that actually is forced up through the prostate to kind of enlarge the opening, of the urethra. So there's less pressure on the, on the urethral opening. Then there's what's called a urolift, where that's a less invasive type of procedure where they go in and put clips to hold up kind of the prostate. And again, that kind of opens the urethra so the urine flows better. And then the fourth one is a little newer that may become the most popular. It's called a prostate artery embolization. So that's done by an interventional radiologist. They go in and put small beads in to reduce the blood flow to certain parts of the prostate. So the prostate actually decreases in size. That procedure was first done in females for fibroids. They were using it for uterine artery embolizations to reduce the size of fibroids. So they started doing that for men now. It's still kind of new, but it is certainly being done. And the recovery from that is so much better and less invasive than any of the other procedures. So I think down the road, we may be seeing that you get more and more, for men with more advanced cases of prostate enlargement, that haven't responded, to the less invasive type of procedure.
Would you say the success rate so far with that is as high as the other
It's as high as the others so far, yes. With much faster recovery, let's put it that way. So yeah. But we'll see how that goes down the road.
Dr. Cronic, can you give some initial symptoms that maybe people can be on the lookout for? We have sort of that age range where it's kind of like you should be going in for your yearly screenings, but what are some of the earlier symptoms that might lead someone to head to the doctor?
Well, related to the prostate, mainly the symptoms are going to be, if you notice there's a change for you, basically. If you've never gotten up at night to urinate, now you're starting to get up once or twice, or you notice even during the day, well, I feel like I'm going to the, and urinating a lot more than I used to. When you feel like you have to empty the bladder, if you're having to stand there a little while, to get the stream started, even though it feels like the bladder is full, that's certainly a sign that there's some obstruction of urine flow already. A lot of times the stream of urine is much slower. Now, 50-year-old man is not going to be like a 20-year-old man. But if you notice for yourself, there's been a significant decrease in the stream. It takes you much longer to empty your bladder. It feels like after you've emptied your bladder, you're having to go back and empty your bladder again, much sooner than you normally would. Those are the most common things you're going to see early on. And certainly you can see that in ages earlier than 50, just based on the person. But those are definitely things that you'd want to talk to your physician about. Because over time, even though it's a benign condition, it does lead to pressure that's pushed up toward the kidney. And the urinary tract is a closed system. So if there's pressure coming in the lower urinary tract, over the years, it's putting more pressure up through the bladder the ureters that go to the kidneys, and even the kidneys. So you can see in men with long-term, we call BPH, prostate hypertrophy, hyperplasia, that you can start getting some natural damage to your kidney just from back pressure that's going on for many, many years. So it is important to discuss that with your physician, if you start seeing some symptoms.
So walk us through, maybe somebody's never done this before. They've never had a screening, they've never gotten checked for this. What does that first step look like? What does the process look like? Obviously, the first step is contacting somebody like yourself, but what does the process look like? What does it entail?
Right. Main thing that I would recommend is, if you have a family physician or a regular doctor you have seen or have a relationship with, or if you don't, it's fine. And most family physicians or internal medicine physicians are very adept at doing kind of physical screenings and wellness exams on patients, men or women. And then based on your age, you would want to just go and have a yearly wellness visit or yearly exam, physical exam. We have a lot of names for them now, but it's basically that, okay, I don't really have any problems per se. Maybe I have a few little symptoms of things here and there I'm not so sure about. So I want to make a list of things I may want to talk to them about. What screening test I may need for my age, what vaccines I may need for my age. Just kind of a list of things that you may want to ask them about if they don't bring it up. Normally there's an exam done, check your blood pressure, pulse rate, heart, sometimes an EKG if you have never had one, just to have a baseline kind of, to check the heart rhythm and everything. And then, after that, most of them, the tests are done with blood. So there's usually a blood test taken. And with the blood test, we always want to look at the blood sugar. Are you diabetic, pre-diabetic? Are your lipids in good range? Because we're really trying to screen for risk factors as well for heart disease, which is by far the #1 killer, men and women. So we want to know your blood pressure, your weight, BMI, your lipids, your blood sugar, all pertaining to risk for heart disease. They'll ask questions about your history. Do you smoke, drink alcohol? Are there other things, family history of various things, cancers, heart disease? So we kind of put all this together and we try to get for this individual, what's their risk for various things that are common or important, right? So at the end, like I say, there's full blood tests done. Part of it would be a PSA level. So usually the tests come back, we look at that. Either different people do it differently. Some people would call, some people now with electronic medical record, we can send copies of all the tests and write there, from the doctor, what we think, what we see, what we recommend. And then based on that, some guidance of, more healthy, lifestyle things that you might can do or look at. And then when to follow up. If everything's perfectly normal, normally once a year or so is, perfectly fine, unless something else comes up symptom-wise with the person. Then usually every year it's good to relook at the level. And if you're on medication, or say you are diabetic, or there's some other, circumstances there, then some of those people are on more of a 3 to 4 month, kind of follow up as well. If the PSA, say it's normal, but maybe it's a little higher than it had been, we may have you come back in 3 months, 6 months to relook at it and see, well, is that a trend? Is it going up more? Or was that just a little blip, and now it's kind of back down to where it had been? So that's what I would recommend people do. And I think as long as you're proactive and and you want to kind of fight for yourself now. It's a big medical system. It's not easy to navigate things. But to make sure you have your questions, and a lot of times it's better to write them down. A lot of times once you're there, it's hard to, think of everything you may want to ask. But that tends to be I think the best we can probably do. Look for things.
And speaking of those questions, Suzanne, as we're talking about aging, healthy aging for our seniors, what maybe are some of those questions that our senior gentlemen should be taking to the doctor? What are some of the maybe higher risk factors as we age that can be problematic? Cardiovascular, maybe it's cognitive health. What are kind of the host of issues that we start to see as we age that we want to be monitoring?
That's a great question. And I love, Dr. Cronic, that you said write it down. And when we were speaking about women's health, we said the same thing. You have to advocate for yourself. And if you're not comfortable doing that on your own, bring a trusted friend, a spouse, someone with you to kind of hear the same discussion you're hearing so that you understand the conversation. And if you feel rushed or that your questions weren't answered, find somebody else, find a practitioner that you're comfortable with and you feel like you're being listened to. Um, so there are some basic lifestyle pieces to this too. And as Dr. Cronic said, the blood panels, your cholesterol levels, your heart healthy people do better in all areas. We are now understanding more about inflammation and the effect it has on the body. And that is a direct impact on the prostate health as well. If you're not sleeping well, which is a common, I think, complaint for men and women as they age, part of it has to do with changes in the urinary habits and other things going on in their life, perhaps stressors. But if you're getting up to void what, 3, 4 times a night, which some of the seniors that I talk to, they are getting up all night long to go to the bathroom and try and urinate. That is a huge impact on healthy living and a REM sleep cycle. So if you are struggling with that, you need to talk about that in terms of your sleep and what's going on with that, which is another really great reason to go and talk about this. I think there's a stigma with, men and women when it comes to reproductive and urinary, anything to do with that, especially with our seniors who are in that age category, the 80s and 90s, because when they were growing up, it was not talked about at all. So we have to really encourage them to talk about it and write down their questions and really be honest about what they are dealing with and not be embarrassed. It's part of a healthy body. If you're having anything that's out of your baseline whatsoever, that's something to talk about with your doctor. So if you started out healthy and then you're having stomach troubles or you're having urinary troubles or heart palpitations, you're out of breath a lot, swelling, any kind of difference, that is something to talk about because it can directly relate many systems of the body. And doctors have so many different choices now to help treat these things. It's up to you to make that choice, but they can present to you so many different options that there really is no reason not to go and address these things.
I think one issue that is kind of hard to detect that doesn't just kind of crop up or is quote noticeable, and that's hormonal changes. And I think on the women's side, it tends to be talked about more, maybe less so on the men's side, unless it's referring to, the erectile dysfunction portion of the hormonal changes. And the quick fixes, so to speak, on that end. But it's so much more than just that, isn't it, Dr. Cronic? And can you please kind of lead us into the discussion on men and hormones and maybe when it might be time to go get looked at, or maybe to give them something else to think about instead of blaming the fact that they're tired in their job or they're tired because of this XYZ. It could just be something related to their hormones.
Right, yeah, we've known for many years that after about age 40, 45, and the main hormone in males is testosterone. There's a normal sort of gradual decline in testosterone after, like I said, about age 40, 45. Uh, a lot of times it's very slow and it's not a problem for most people. The symptoms as we get older may gradually get worse, and we just think, well, I'm just getting older. That's how I'm supposed to feel. But now we're seeing a lot of symptoms regarding the cognitive health of people, the mood of people, as far as if you look at the list of symptoms for low testosterone and the list of symptoms for depression, they're the same, pretty much. So you have that aspect of it. You have certainly a slowing of cognition, which we always say, oh, my memory's just bad because I'm getting older. But that's not always true. The physical aspects of it we see, mainly definitely is erectile dysfunction, but it's also loss of muscle mass, strength, and recovery from exercise. So one of the best things we can do as we age, and it doesn't matter if you're 90 years old, is exercise. Well, if we're not able to, we get even weaker. So that leads to problems with balance. That leads to problems falling, which is one of the most common things that happen to people over 80 or 85 years old. There's about a 50% mortality in 90 days after a fall, especially if there's a fracture involved. It's not because you fell, it's just because of the complications from what happened after you did fall. So these are very serious things that we might can do something about. So when men have a lot of symptoms of low testosterone, and you can, anybody can Google that symptoms and they'll have checklists, that you can go through and see, okay, I've got, this, and this. That's something you certainly want to write down and discuss with your doctor. Those again, levels can be measured through the blood, and we know now that testosterone replacement can be very important for these symptoms, for well-being, for strength, for cognition, for mood, in men. And there is some evidence now, maybe for preventive heart disease and some other things. So that's also an important, thing to look at. Now, not every man with low testosterone needs to be on testosterone. There might be a reason there that can be picked up as well. We can work on the underlying reason, and the testosterone will go up without taking testosterone. So not everybody needs testosterone because they're a little low. The side effects from testosterone really don't come into play when you're replacing somebody from low to normal. The side effects we always hear about and see in the media and things, it's usually people that are using testosterone that are not low, but using it for enhancement of something, right? So we've been very safe when it's monitored, and used in the, in the medical forum. So that's also something I think to be aware of, for me.
Can we talk about, for both of you, when we talk about testosterone, right? And you seem to, we seem to think, or it just seems in the media or what have you, whether it's online, that it's kind of for this certain subset, this age group, right? Maybe men who are in their 30s and they're starting to see a decline, 40s, 50s. But then after that, it's kind of like, oh, well, I've just hit this certain age, and do you even see people who are practicing medicine that are even offering that as something for somebody in their 70s, their 80s, and their 90s. What about that subset, that group of individuals? Is that even something that is commonplace in the medical field to be even offering testosterone to somebody in that age range?
Well,
Should we be doing
it
that? Should
should
that be
be.
something that
Yeah,
should be pushed?
it should be as a, but more as a one-on-one thing with your physician in your situation, looking at your risk, your benefits, not going online to a website, that sells stuff, right? And they'll sell you anything you'll buy.
Mhm.
They're certainly marketing toward younger people. And so those, I think, you certainly have to be careful with that type of thing. But in situations where individually you're discussing your issues, symptoms with your physician, and he or she is looking at your situation with your test results, with the medicines you're already taking, with your other medical conditions, and individualizing, your treatment and what's, like I say, benefits you versus the risk to you, then it may be something that is worthwhile. And then it's monitored. When monitored appropriately, there's not usually any problems there.
That's really good to know. And you mentioned something, and maybe Suzanne, you can touch on this too, when it relates to nutrition and things that maybe can help without the need for testosterone replacement. What are some of those things nutritionally, or as you mentioned, working out, things that people can do to naturally sort of give themselves that boost that maybe they've been missing?
Well, you mentioned Dr. Cronic, and I thought it was very interesting. There are some supplements that are encouraged for prostate health. You touched on one of them. Are there any others that you might recommend?
Uh, there's several that are just considered like for healthy prostate. Some of them will have different supplements in them. Usually saw palmetto is usually the main one.
Mhm.
There's some with selenium. There's some other vitamins and things that are in some of those supplements for the prostate that are certainly safe and worth trying, at least early on. Because I've had some patients with mild symptoms that have been on these now for several years and they haven't gotten any worse. So we just don't have a lot of normal pharmaceutical studies, double-blinded studies on most supplements, and we don't have a lot of knowledge on the exact dosing or how much you need, but if you get a legitimate supplement, through a legitimate supplement company, most of those do their own, at least studies enough to know the dosing of it and the safety of their products. So these are things, as long as you're getting from a trusted, supplement supplier, you should be fine, with that type of thing.
Right. And of course, the heart healthy diet is across the board.
Correct.
The Mediterranean diet kind of thought process. What is healthy for one part of the body is healthy for all of it. And that is a big area that we need to look at for all of us with our well-being, is those things that we can do that will prevent disease processes initially or prevent them from getting more serious. Can we talk for a minute about stress? Because that's one thing I feel we all have more of these days, and stress does have an effect on the prostate health and, of course, our health overall.
Everything. Yeah. And this whole process is all intertwined, right? So when there's a problem with stress, there's more cortisol in the body, which is a steroid, right? There's typically then more visceral fat, which is the fat most of us store in our abdominal area. So the more visceral fat you have, the less well your insulin works. So then you get into a problem where now you're insulin resistant. your pancreas makes more and more insulin to try to keep the blood sugar normal. Well, this does a lot of things. One thing insulin does, it blocks the effect of a stimulating hormone from your brain that causes you to make testosterone. So in a roundabout way, that lowers your testosterone. So one of the ways you can increase testosterone is by lowering carbohydrates, sugars in the diet, and losing weight, especially in the abdominal area. Then the insulin goes down, your blood sugar stabilizes, and your testosterone goes up. So again, when you get to the stress reaction, there's a lot more cortisol in the body. Well, cortisol, it causes weight gain, it causes bad weight gain, it increases inflammation in the body, which leads to pretty much every disease we have, whether it's diabetes, cancer, arthritis, name it. More inflammation we have, more disease we have. And that's a direct effect of stress usually. And stress comes in forms of just external stress, emotional stress, things we have to deal with every day that we didn't used to have to deal with, and not sleeping well also does the same exact thing. So lack of quality sleep, lack of good nutrition, lack of exercise, and more stress, all of those things play into about every disease we can have. It certainly makes it more common.
Right.
Yeah.
There's very much a causation between all of those things. Exercise is a great way to lower your stress and also perhaps cut down on your weight and just an overall healthy daily habit. What would you recommend if someone came into your office and just said, I really don't know what to do in my life to have the tools to go towards a healthier lifestyle? What would be the basic things you would recommend?
Well, usually what I like to do is sort of a full physical panel to see if there's something here, that's obvious. You'll occasionally come across somebody that's got a very underactive thyroid, or somebody that's got something that if you don't correct that, nothing's going to get better. So obviously we look at that first. We look at the lifestyle they have right now. How much are they working? How much are they sleeping? How much are they exercising? What are they eating? When are they eating? All that has a lot to do.
And are they drinking a lot of alcohol? Because that's another
alcohol
side effect.
definitely is another problem. Yeah, it's pure sugar. So obviously that's, you want to minimize or not drink alcohol. Smoking is a no question. I mean, I think for now 50, 60 years we've known that. So we want to look at those things. We want to see, like, again, what can we do with the diet? We want to reduce, most of the time, the easy things are soft drinks and fast food. You can get rid of soft drinks that have high fructose corn syrup, fast foods, which are loaded with same thing, high fructose corn syrup, which is the worst chemical that's ever been made, probably besides nicotine. If you get rid of those two things in most people's diet, that's going to make a huge difference. And then increasing healthy things, increasing vegetables, different colored vegetables, lean meats, good fats, which would include avocado, nuts, things that are good for us. It's not only just getting rid of things that are bad, but increasing things that are good. Plenty of water, hydration is extremely important. And then we want to look at the exercise, and we want to say, where are you? Are you doing nothing? Well, if you're doing nothing, doing something is better. So if you can get up and walk around your house twice, 3 days a week, that's better than nothing. Next week, go 3 times. Next week, 4 times. Start doing something. And then we try to keep building on that. Are you getting enough aerobic exercise? Well, when you are, let's start looking at some resistance training. Then you don't have a gym, there's plenty of things you can do with bands, with light dumbbells, with things that you can do at home to increase your strength, which also increases your balance, prevents falling. Now you're burning calories more because resistance training continues to burn calories, not just while you're exercising versus aerobic exercise, which you only burn calories while you're exercising. So we want to incorporate both of those things. So we kind of looked at where you are and what are we going to do, to get to where we want to be. Then we try to, you want to follow up. You want to follow these people up 3 or 4 months, see where we're at, what do we need to change, what's not working, what is working. And then we can get into more details, of specific things we might can improve on. And then if we need to, sometimes if we're dealing with somebody that's diabetic, we may need to incorporate a diabetic nutritionist to work with them, very specifically on diets, how to read labels. Some of them will even go shopping with the patient, just, go to details of what we should be eating, how to look at things and how to convert, what sugars to eat, how much. So we just have to go by each person, and try to figure out for them. So, but you have to start somewhere, and it's never too late. There's studies now they're doing on people 85 and older, and if they can get people to exercise, it increases their lifespan even after that age, and their overall well-being after that age, less falls and less injuries and fractures, even in people over 85 years old. So there's, like I say, it's never too late to, do something.
Yeah.
So,
And I love that you mentioned that because I think we preach that almost every single webinar when
right.
we
We don't
talk
want
about
people,
health.
well, we don't want to retire when we're 65 and say, okay, that's it. I'm sitting here
Right.
watching TV. Right.
Well, I mean, we could literally go hours on this topic. Unfortunately, we're whittled down to the 1 hour. We've got a little less than 10 minutes left, and we do want to open this up for questions for our audience if they have any. It's a great opportunity to ask your questions to Suzanne and to Dr. Randy Cronic. We do have one question that I will throw out to both of you. It's from Anonymous. If PSA, this is going back to prostate health, if PSA is high and no focal mass is detected on MRI, what type of follow-up is required?
Okay. In my opinion, now, all medical opinions are not exactly the same. You may get 10 opinions if you talk to 10 doctors, right? My opinion would be a couple of things. One is the patient's age, the previous PSA levels, basically. Is this, is it a little high, but is it about what it has been, or is it 3 times higher than what it was? I would normally at that point either repeat the test in 3 months, and there are some advanced PSA testing that will show you what the free PSA percentage is. It's just a little more detailed test. That's typically done when the PSA is between 4 and 10, which 4 is the upper limits of normal. So if somebody that's got 4 to 10, when I usually repeat the test, I would do a free PSA. That gives you not only, again, is the trend still going up, and is the free PSA lower than what it should be, and that tells you then the person's risk of having cancer. Do they have a 5% risk or a 70% risk? So that would be a person. So say if we did another one in 3 months and it was twice as high again as it was then, even if something's not seen on the MRI, those are patients that probably should still have biopsy done. And the way those are done, usually the prostate's kind of sectioned off into 12 zones, and they take a biopsy of 12 spots. So you kind of don't miss any areas, of the prostate if there's not a specific anatomical site you have seen, that looks like it could be a tumor. So that's usually how that would be approached. Because even in aggressive prostate tumors, they still don't grow very fast. So if the prostate's just a little higher than it had been, usually first thing is to recheck it. Sometimes you can get a very low grade prostatitis, which is a little bit of infection in the prostate. And I have seen a lot of urologists, especially if somebody's prostate has been normal and it comes back really high. A lot of urologists will treat them with antibiotics and then repeat it just to see, because if you have some infection in the prostate, it can really increase the PSA, like really high. And so that would tell you right away, once it's treated, if it just goes right back down, then we're not dealing with a problem.
Great answer. I hope that answers your question, Anonymous. And I think we had an audience member, Reginald, that was raising his hand. Reginald, if you want to get a question in for the doctors here today, you go to your Q&A button down at the bottom of your screen and type your questions out there. All video and audio has been muted for our guests. So that is the way that we can interact with each other here today. One more thing as we're kind of winding down with the webinar here, and you hear it all the time. I'm not a man, but Randy, I know you can answer this. It seems it's pretty difficult to get most men to go to the doctor unless there's a little prodding or pushing from a spouse or family members. What
Or
do you
threatening.
do? What is the advice? Because you can't help you if you don't show up, right? So what is the advice that you give to your male patients in order to get them to come in on a somewhat regular basis to catch some of these issues early?
Well, I'm kind of laughing because I am a male and I have a wife. So,
and I am a wife and I know what I have to do.
Yeah. Now we try to make it a little bit easier for people. If once a year, it may be an hour of time. It's not that much to it. 98% of the information we get is basically from your history and the blood test we do. That way we can tell what something might be going on here, or it looks like you're fine. If you're not having any symptoms of any problems, your history's pretty clean, your labs look good. It's not a big, there's not a lot of poking and prodding and pain involved other than getting the blood drawn, with the needle. So that's about it.
Can I ask a quick question? Because I know there was a digital exam involved. Is there still, or is that kind of gone by the wayside?
Okay. That's still in the official recommendations from 50 years ago. That was really before there was PSA testing. You were trying to tell if there's a tumor. Mm-hmm. Well, you're not. If you find something that's a tumor, that's not a good time to find it. PSAs are going to find things that are microscopic. Now, again, 10 doctors, 10 different reasons. I don't usually do them routinely unless there's symptoms or a problem for screening. Why? Because I don't see an advantage. I did probably hundreds of thousands in the last 31 years. I never felt a nodule where there was no symptoms. Mm-hmm. So I can't say that that's accurate enough to put somebody through. If there's a reason, or like I say, symptom, or there's a increase in PSA, or reason to do that. And usually when those tests are needed, or MRI, I always have people go to a urologist. That's their specialty. And they generally, take care of that. And like I say, in the MRI, you're going to detect tumors within the prostate that you couldn't feel anyway, external. So that's my opinion. That certainly would be debated by many doctors.
I think that's the trend now. And I say this because I think a lot of men are hesitant to come in because they have that looming over.
Right. last thing I'd want is a man not to come in because they're worried about that. So I wouldn't worry about it.
Yeah. See, and this is why we have these webinars so that
Right.
things like this. And we've had quite a
Everybody's
few
got their own
comments
opinion.
today.
Right.
Yeah. Harvey said that's a good question. And we want to get to Reginald's question before we wrap up here today. I know he's been trying to get this in. So
Okay.
Reginald says, I'm 65 in great health, a plant-based eater. I walk and work out. Good job, Reginald.
Yeah.
I get my prostate checked annually. Yay.
Wow,
I take a lot of
Reginald.
herbal teas with diuretics, burdock, chamomile, dandelion. So I urinate a lot. Should I be worried?
Probably not if you're getting your yearly, PSA and exams. If they're not seeing any, problems there. If it's frequent urination, but the stream is still, strong, there's no, what we call hesitancy, which means that, oh, my bladder's full, but I'm standing here, 20 seconds before I can start the stream. That hesitancy and then the slow stream, I would be much more worried about than just the frequency of urination, especially if you're drinking a lot. I mean, which is good, and if you're on a diuretic, obviously too, that might have an effect. The other thing that, as long as you're not losing significant sleep at night, getting up every hour or two, that would be an issue that would be more important as well. Just during the day, I wouldn't worry that much.
Yeah. Reginald, we hope that that answers your question. It was a great question, and we would really, really appreciate you gentlemen being a part of our conversation for this webinar today. It was all for you. So we thank you for being here. We thank you for watching, and we certainly thank you, Suzanne Price, and you, Dr. Randy Cronic, for being a part of the conversation for our audience here today, and sort of a beacon for those who may have questions and maybe were too afraid to ask. And we hope that everybody was able to take a little bit of something away from this webinar as we enter and are still currently in this September Prostate Cancer Awareness. So thank you both so much for being here today and for sharing all of your knowledge with our guests.
Thank you.
Well, you're welcome. Thank you very much.
Yeah, and like I said, we could have gone on for hours about
Yeah,
this.
there's a lot to go
We
there.
barely even touched mental health, so we hope that both of you come back
Yes.
so that we
We
can
can
have
come back to
that
that later.
discussion.
Yeah.
Right. Certainly.
Thank you. All right.
Okay.
Well,
Yeah, we understand.
yes, we could, like I said, we could go on forever, but we do have our shortened time. However, for those of you who enjoyed this webinar and you're looking for more information about senior living, you can head on over to our website. It is www.seniorlivinglive.com. There you can find videos all about senior living geared just for you. And the best part, they are available 24/7 and they are all free and on demand. We thank you all so much every day for being a part of Senior Living Live in some way, shape, or form. We hope you have a great day, everybody.